Hello everyone, I am Dr. Shreyash Thool, second year junior resident at Department of Radiodiagnosis at Dr. Panjabrao Deshmukh Memorial Medical College, Amravati. Today, I am presenting a rare case of senile cervical stenosis with hydropyometra. I have prepared this case presentation under the guidance of Dr. Sushil Sikchi, Professor of Radiodiagnosis. Methods. It is an observational study and is carried out in the Department of Radiodiagnosis at Dr. Panjabrao Deshmukh Medical College, Amravati. A female patient aged 65 years presented with excessive foul smelling discharge from vagina and lower abdominal pain since more than 1 week. The patient voluntarily included in the study, and the patient was neither supported nor additionally burdened financially. No past history of surgery. All blood parameters were normal. Case report on ultrasonogram. Transvaginal sonography was done where imaging finding shows distended uterus with hypoechoic collection in endometrial cavity with organized debris within. Tenderness was seen on uterine palpation. The approximate volume of the collection was around 32 ml. On Doppler study, it does not show any vascularity within the collection. On follow-up CT, it shows distended uterine cavity with complex endometrial fluid collection with varying attenuation between 14 to 35 Hounsfield unit. On follow-up MRI, T1 weighted sequence shows low signal intensity. T2 weighted sequence shows mixed signal intensity, where high signal intensity was for free fluid and intermediate signal intensity for pus accumulation. On T2 weighted oblique view, it shows cervical stenosis with narrowing of the cervical lumen. On diffusion weighted images, it shows restriction diffusion seen filling the endometrial cavity. Etiology. In premenopausal age group, it is seen normally and cervical stenosis and imperforate hymen. In postmenopausal age group, it is seen in cervical stenosis, endometrial carcinoma, endometrial hyperplasia, endometrial polyp, cervical polyp, and use of estrogen replacement therapy. Pathology. There are essentially three types of fluid: hydrometra, that is simple fluid; hematometra, that is hemorrhagic content or clot; and pyometra, which is pus. Discussion. Pyometrium refers to infection of the endometrial cavity with resulting expansion due to accumulated pus, that is pyometra. The postmenopausal demographic age group are the most commonly affected due to the association with uterine or cervical malignancy and cervical stenosis. Other causes include pelvic inflammatory disease, endometritis, endometrial polyps, retained product of conceptions, and other urogenital anomalies. The clinical features of pyometra includes whitish discharge per vaginum, postmenopausal bleeding, pelvic pain. Pyometra may rupture spontaneously, but it is very rare complication and it is much difficult to diagnose preoperatively. Symptoms usually similar to the gastrointestinal perforation and Peritonitis. Treatment. Patient with spontaneously ruptured pyometra should undergo emergency laparotomy or hysterectomy or peritoneal lavage and drainage. In this patient, there was total abdominal hysterectomy. Conclusion. In conclusion, although pyometra is rare, it should be considered as the one of the differential diagnosis in all cases. MRI of the pelvis showed a heterogeneous fluid collection with showing restriction diffusion seen filling the endometrial cavity. Thank you.